we kind of feel that the time is now to move away from, the daily reporting. This is really useful in an acute outbreak situation when you really need to monitor what's happening on a daily basis. But I think the time for that is past. And I think what we've also seen is that, the daily numbers are not that useful. We already know there's low testing over the weekends. So come, Monday, our numbers are going to be low. Usually the Wednesdays are, kind of when people have returned from the weekend.
That's Michelle Groom from the National Institute for Communicable Diseases. Dr. Groom and her team have been showing you how many COVID-19 cases, hospitalizations, and deaths have been recorded in South Africa. They do this with dashboards and media updates on their site, as well as infographics on Facebook and Twitter. Later on in this podcast episode, we'll find out how much work it takes for the NICD to make these daily updates, and when she thinks they'll stop. But first, we've got an announcement to make.
This is a Bhekisisa podcast.
I'm Mohale Moloi, a multimedia reporter here at Bhekisisa. Since March, I've been managing our daily COVID updates. If you follow at BhekisisaMG on Twitter, you will have seen the maps of COVID cases and vaccinations that we post every day. Our team of journalists have made these daily updates for more than 2 years now. In that time, we have recorded over 15,000 rows of data to make almost 650 daily COVID-19 infographics. We also followed vaccinations until half of all adults in the country have had at least one jab. But after 837 days, thousands of Facebook, Twitter, and Instagram posts, we have reached the end of this journey. From today, we'll no longer be posting COVID-19 daily updates. This is a story about why we started these updates, what it took to keep them going, and why scientists think it's time to move on from them. This story starts with a spreadsheet. We worked in teams of 2, and each week a different team was in charge. Once the health department and the NICD have published the day's COVID numbers, the team's map maker gets going.
Hi, I am Yolanda Mtseke. I usually sat down to start recording the data from 8:15 onwards, just because I found this the most convenient time. I would have had dinner by then, and I would have unwinded from the workday. I tended to start with the vaccination data, as that would be consistently posted on time and early enough in the evening.
Yulendria Pasami. So I'm a bit of an early sleeper, so I'd like to get the maps done as soon as possible the night before. There's many columns of data you need to fill in every evening. What you're also doing is checking for accuracy, creating captions. You're also inputting the data into the map. The way that Joan and I have broken it down is that she would check the numbers that I input and she would check the graph that I create and post all of that in the morning.
I'm Joan. So I was just checking the millions of spreadsheets. I'm usually checking it in the evening after Len sends me, but I'm also the type of person that's like, no, it's fine, I'll get up early tomorrow.
I am Dylan Bush. I feel like I know the maps quite intimately, but I settled into a checking role. When I wake up, I make coffee, it's 4 a.m., and then I check the maps.
I'm Rosalind Daniel. Being a checker is good because you just check. Obviously, you have to go back to the source and check that. You can't just take it for granted that the person has everything correct.
We're a team of journalists, so we like to be correct. But data wasn't our forte, so we needed systems that would help us make sure that we got things right. Formulas or calculations we put in a spreadsheet did a lot of the heavy lifting. Having makers and checkers on every team also allowed us to double-check effectively. Yolanda explains why this was important.
Because we're working with such large values, we're talking millions of people vaccinated and thousands of cases. Sometimes the changes would be so small you would hardly notice it.
Here's Yulendri again.
It does get a bit frustrating when the numbers don't add up or when You're completely confused by a sudden uptick in a province's active cases, and you've spent like a while trying to figure out where the stat came from.
Biggest schlep is just the time at which the government releases the maps varies from day to day.
That's Jesse Copeland. He and Zano Kunene are the newest members of Team Bekisisa, having joined this year. In a short time, they have already gone the extra mile to get this data out. Here is how Zano worked around a power outage.
So I remember one day I had load shedding in the evenings, and the government only releases the data in the evenings. At around 10:30, they turned the power back on. As it turned back on, it immediately switched off. So I waited and waited. By that time, my laptop battery had died. I actually woke up at 6. The power still wasn't back. So I ended up having to go to the McDonald's down the street from where I stay and do the spreadsheet and make the graphic for the map.
What? Working at McDonald's? At this point, you're probably wondering why we did all of this in the first place. Here's Joan again.
Fortunately, it was quite obvious what the value of it was. We did have those very dedicated readers that were really engaged in how numbers were changing and seemed to be using it to inform their behaviors. Like if they see the cases going up in their province, we heard from people saying that they use that to decide what kind of situations they're going to go into.
Team members who worked on this project the longest, like Aisha Abdul Karim and Dylan Bush, noticed that this work had its particular drawbacks. Here's Dylan again.
Originally, it was Aisha who just did the maps, and then it was Aisha and me. So we did them for about, I think, 3 months, just the two of us. It was super depressing in the beginning. Every day you're looking at how many people have got it in each province and how many people are dying in each province. And you've obviously got family and friends who you care about. It took a toll eventually. I think that's why we started to share the load. At some point you realize it's not just numbers. Those are dead people.
In June last year, we were given some reason to have hope and new numbers to count in the form of vaccinations. This is how Yolanda felt.
When the vaccination drive first started, I think I was excited and thankful that we were able to get vaccines and that our most vulnerable would be assisted and vaccinated first. It took the pressure off knowing that my grands would be vaccinated.
The vaccine drive hasn't been perfect. Last September, for example, it took us less than a week to get 1 million people vaccinated. This May, getting 1 million jabs done took about 27 days. Yulendri sums up how we felt.
At the beginning of when we received vaccines, there was a lot of attention around vaccines and our numbers were a lot better. But these days, logging the vaccine numbers and seeing how slowly people have actually been using the vaccine has been really disheartening.
It's not just Team Bekisisa that is reconsidering these daily updates. After the break, you'll hear from Michelle Groom on why the NICD are also thinking of doing away with daily COVID updates. She gives us a window into how viruses will be tracked in the COVID normal future. Welcome back. When COVID hit South Africa in 2020, we were all watching the daily case numbers as the virus swept through the country. At Bekisisa, we spent a lot of time distilling the health department's data into bite-sized chunks every day. But that project is now over. We're not the only ones thinking about COVID data differently. The NICD says their daily COVID stats may be a thing of the past soon as well. If you're one of the people who have been using daily data from us or the NICD to decide what your social calendar looks like, don't worry. There are some statistics you could look at instead. Here's the NICD's Michelle Groom.
I'm head of the Division of Public Health Surveillance and Response here at the NICD.
When you started this process, did you know that it would be such a huge project and that it would last this long?
We didn't know how big COVID was going to be. And, in the peak of the wave where we were getting, say, 70, 80,000 tests coming through a day, we have to take out the duplicates, so if someone had maybe a PCR and an antigen to make sure we're not counting them twice. We were getting results from the NHLS as well as many, many private laboratories. The data provided by the laboratories isn't complete. And so it was even from our team phoning provinces, phoning to try and see which districts were cases from. We've got epidemiologists in each of the provinces as well, which are liaising with the provinces in terms of trying to collate data. We've got our whole communications team working on a roster basis to be able to put out these data. And obviously the liaisons, with that, and if anything had to go wrong at any time, the amount of extra work then in trying to sort that out.
That's a whole lot of people. Do you think there will be a day where the daily reporting will come to an end?
I think at this stage, more than 2 years in, we've really seen low numbers of cases being reported. We've seen low levels of hospitalizations, very few deaths. We kind of feel that the time is now to move away from the daily reporting. This is really useful in an acute outbreak situation when you really need to monitor what's happening on a daily basis. But I think the time for that is past.
And why is that? Why has the time for this passed?
Putting out the case numbers is really not useful in forming public health response. We've seen in this, anecdotally, many people have had COVID. I think our testing numbers are at an all-time low. And so we really can't interpret what we've seen at the moment in the same way we did in the peak of, say, the second or third wave.
You said our testing is at an all-time low. Why is that? And what does it mean for how we interpret the number of daily infections we see?
Maybe I've had it before, I've been vaccinated, I have a sore throat and a bit of a fever. I may decide, I'm not going to go and test. Whereas if, I had difficulty breathing and now I was really, getting sicker, I would go to my doctor or my healthcare professional and have a test. So only the people who really think they've got COVID and maybe are more severe are testing. Whereas before, many people tested because they were just worried they were in contact with someone. We never had a good handle and we weren't recording the reason for testing. With not knowing that, it's really difficult to interpret.
If COVID testing numbers aren't giving us a full picture anymore, what numbers can policymakers use to make decisions?
We're worried about hospitalizations and deaths. If there's any indication that there's pressure on the hospitals, for example, in the third wave, especially Gauteng and other provinces, there was really a lot of pressure on hospital beds. And I think that's when we really would want to intervene. Hospitalizations is a good indication. So those hospital metrics are good to watch. But just in terms of overall risk assessments, we started wastewater surveillance, which has been done by the NICD, which is really testing wastewater for COVID. And what we've seen is this correlates quite well when the cases start increasing, and even a little bit just before.
Let's say I'm an immunocompromised person. If I'm still worried about how much virus is going around, can I also check these dashboards? How will I know if I can go to that gathering?
You can go and have a look in your area or your district. Is detection going up? That means maybe there's more circulating. If I'm 60 and I have diabetes and high blood pressure, I may decide that I want to wear my mask even outside. I may choose not to go to a place that's going to be very crowded. So I think we're going to be moving more towards that. We would expect that, COVID may move towards something like influenza, which we've managed for many years. We kind of know there's certain seasons when there's higher risk. We know who our high risk people are for severe disease. We encourage vaccination in our high risk individuals. And I think we will be moving to that kind of more risk-based approach.
When the NICD does stop its daily reporting, can I still find these numbers somewhere?
I think what we really like to move towards is having everything available on our website, having a dashboard, and interested people can still get the numbers, but it's not letting everyone formally know. The information will be available.
That's our show. It was hosted by me, Mohale Moloi. Joan van Dijk edited and contributed alongside Yolanda Mzeke, Yulendri Apasami, Jesse Copeland, Zano Kunene, Rosalind Daniel, and Dylan Bush. Our editor-in-chief is Mia Malan. Danny Boyson is our sound engineer. Thank you to Aisha Abdul Karim, who started this project and ran it for most of its existence while she was at Bekisisa. If you still want to find COVID data, we'll leave links to all the NICD and health department sources in our show notes. You can see all the data we captured and the maps we made at bekisisa.org. Thank you, and if you made it all the way to the end of the show, please leave us a rating where you listened. It goes a long way to making sure people can find us. If you liked the podcast, consider sharing it with a friend.
This was a Peggy Sisa podcast.